Hello. I'd like to now introduce Brenda Ray. Brenda is a speech pathologist at Children's Hospital here in Seattle, and she's agreed to come and engage in a discussion about some of the issues that we've been discussing this morning in our course. Welcome.
Thank you. Thank you for having me.
What kind of questions do you have for me this morning?
Well, my first question is, does a physician have to diagnose childhood apraxia of speech?
I'm so glad that you asked that. This is such an important thing because it is a misconception that this is a medical diagnosis best diagnosed by a physician. The truth is that diagnosis or the label childhood apraxia of speech is just that. It's a label for a subset of children that have a certain kind of speech sound disorder. So it's a speech diagnosis, not a medical diagnosis. So the speech pathologist is actually the person best trained to make this diagnosis. I'm not sure how this came about. Probably the term apraxia sounds so neurologic that people think it's a medical diagnosis, but in reality, it's just a label for a subset of children that have speech sound disorders and is best diagnosed by the speech pathologist. The truth is, and I think this is very important for those of you watching this webinar, that if children are delayed in developing speech, likely the first person they'll go to is the pediatrician, and that's appropriate. And your pediatrician will be able to tell you whether or not the child needs to be seen by a speech-language pathologist. At the Mayo Clinic, I'm involved in teaching pediatric residents as well as pediatric residents pretty much all they're going to know really about speech development and diagnosing different kinds of speech disorders. But we don't get into all the nitty-gritty about, what child has apraxia of speech versus dysarthria. They just don't have time for that in their curriculum. So we are the professionals that would best make that diagnosis.